years old professional footballer is admitted to the emergency department. During tackle, his leg is twisted with knee flexed. He hears a loud crack, and his knee rapidly becomes swollen. Which of the following structure is the main site of the injury? That means a professional footballer during tackle suddenly leg twisted and knee flexed, and sound is a loud crack and knee become rapidly swollen. So these 2 points is enough for diagnosis for any type of the question. So what is the options? Options are the anterior cruciate ligament, posterior cruciate ligament injury, menisci tear, medial collateral ligament injury, lateral collateral ligament injury. So first of all, let's see the anatomy of the knee joint. There are 6 type of the ligament present in case of the knee joint. They are the anterior cruciate ligament or ACL, PCL or posterior cruciate ligament, medial menisci, lateral menisci, medial collateral ligament, and lateral collateral ligament. So any of the structure may be injured, but most common ACL, medial menisci, and medial collateral ligament. They are the most prone to get injured. So first of all, let's see the anatomy of the knee joint. This is the anterior cruciate ligament. This one is the anterior cruciate ligament, and this one is the posterior cruciate ligament. This is the anterior part, and here this is the posterior part. This one is the anterior cruciate. This one is the posterior cruciate ligament. This is the anterior border of the tibia, and this is the anterior part of the femur. And here we can say this is the popliteal artery. When popliteal artery going in the side of the knee joint, it giving the medial geniculate artery and genicular artery, and this medial genicular artery, it supplies the anterior and posterior cruciate ligament. And the medial geniculate artery or medial genicular artery, it goes directly within this anterior cruciate ligament. So any type of rupture or injury in the anterior cruciate ligament, what will happen? The blood will be accumulated in the knee joint, and knee joint will be swollen very fast. Also here we can see this is the menisci here. So it is the in short knee joint anatomy regarding this question. So here we can see this is the anterior cruciate ligament, and this tearing, and this is the menisci. So these are the menisci, and this is the anterior cruciate ligament. This one is the posterior cruciate ligament. And when here we can see the anterior cruciate ligament are torn. So when the anterior cruciate ligament torn, in this condition, the blood vessel going through this, so what will occur? Which is the medial genicular artery. This medial genicular artery will be ruptured, and the blood will be accumulated in the joint and causes the knee joint swelling. This is the another picture showing the knee joint anatomy, and when this picture is big, then this condition occurs. This is the anterior part, this is the patella, the lower part of the femur, that means the femoral condyle, upper part of the tibia, and this one is the anterior cruciate ligament, and posterior to anterior cruciate, it is the posterior cruciate ligament. And the ACL, that means this is the anterior cruciate ligament, and here we can see the tearing of the anterior cruciate ligament, here the partial, but sometimes it may be complete. So rupture anterior cruciate ligament, what is the fissure? It usually the sports injury and twisting injury. So this point is very important. It is the twisting injury. So the anterior cruciate ligament, usually it is the twisting injury, and there is a loud crack and rapid knee joint swelling. So this point, and the knee joint swelling occurs. Why? Because there is the hemoarthrosis, that means the blood accumulation in the knee joint. Why blood accumulation there? Because the medial genicular artery, they are lies within the anterior cruciate ligament, and when there is tearing of the anterior cruciate ligament, also tearing of the medial genicular artery, and causes accumulation of the blood. And also when there is a fracture or rupture, in this condition, pain. So pain and rapid swelling, this is the diagnosis of the anterior cruciate ligament. But when there is a pain but the knee joint swelling is less, that means the 6 or 8 hours later or 1 day later, in this condition the answer will be the menisci tear. Also there is poor healing and the management, physiotherapy or surgery. So in case of partial damage, physiotherapy may improve, but in case of the complete damage, usually surgery required. So what is the answer? As there is the loud crack and the rapidly swelling of the knee joint, there is the twisting injury. So the answer is the anterior cruciate ligament injury. And in case of anterior cruciate ligament injury, there is a clinical test. This is the anterior draw test. So in case of anterior cruciate ligament, there is anterior draw test positive. In case of posterior cruciate ligament, there is the posterior draw test positive. In case of menisci tear, what occurs? There is the McCurry test positive, and also there is pain develop, but the swelling late. So pain develop and swelling late, it is the menisci tear. But when there is rapidly swelling of the knee joint, in this condition, anterior cruciate ligament. And in case of medial collateral ligament, it is the positive valgus stress. In case of medial collateral ligament injury, there is positive valgus stress. And in case of lateral collateral ligament, it usually less injury occurs. So in case of medial collateral ligament, positive valgus stress positive, and in case of lateral collateral ligament, there is easy movement of the varus position. So it is in short about the different type of the injury of the ligament around the knee joint.